us about yourself and your nursing experience. Sample answer. Hello, my name is, your name, and I am from Kerala. I completed my nursing degree from Name of Nursing School University and obtained my nursing license soon after. I am a dedicated and compassionate nurse with years of experience. I have worked in various healthcare settings, including mentioned previous workplaces. My passion for patient care and continuous learning has driven me to pursue a career in nursing, and I am excited about the opportunity to contribute my skills to your esteemed institution. What are the roles and responsibilities of nursing? Roles and responsibilities of nursing include providing direct patient care and assessing their health needs, administering medications and treatments as prescribed by healthcare providers, monitoring patient vital signs and reporting any changes or concerns, collaborating with other healthcare professionals to develop and implement care plans, educating patients and their families about their conditions and self-care techniques, maintaining accurate medical records and documentation, promoting health and preventing illness through patient education and community outreach, advocating for patients' rights and ensuring their well-being and safety, adhering to ethical and legal standards in nursing practice, continuously updating knowledge and skills through ongoing education and professional development. What are the common vital signs and their normal ranges? The common vital signs and their normal ranges are as follows. Temperature. Normal range is approximately 97.8 degrees Fahrenheit to 99.1 degrees Fahrenheit, 36.5 degrees Celsius to 37.3 degrees Celsius. Heart rate. Pulse. Normal resting heart rate for adults is 60 to 100 beats per minute, BPM. Respiratory rate. Normal breathing rate for adults is 12 to 20 breaths per minute, BPM. Blood pressure. Normal blood pressure for adults is typically between 90-60 mmHg and 120-80 mmHg, millimeters of mercury. High blood pressure is considered to be 140-90 mmHg or higher. The first number, systolic pressure, represents the pressure in arteries when the heart beats. And the second number, diastolic pressure, represents the pressure in arteries when the heart is at rest between beats. Oxygen saturation. SpO2 to normal oxygen saturation levels in the blood are typically 95% or higher. Blood glucose level. Fasting blood glucose, before meal 70 to 100 mg DL, 3.9 to 5.6 mol L. Blood glucose 2 hours after a meal, less than 140 mg DL, 7.8 mol L. What's the meaning of fifth vital sign? The fifth vital sign is pain. In addition to the traditional vital signs of heart rate, blood pressure, respiratory rate, and body temperature, pain is recognized as an essential indicator of a patient's health status. Assessing and addressing pain is crucial for providing comprehensive patient care and ensuring their comfort and well-being. What is the sixth vital sign? Walking speed. What are the normal vital signs for newborn babies? The normal vital signs for newborn babies are as follows. Heart rate, pulse rate. Normal range, 100 to 160 beats per minute, BPM. Respiratory rate. Normal range, 30 to 60 breaths per minute. Blood pressure. Normal range, systolic, top number around 60 to 90 mmHg. Diastolic, bottom number around 30 to 60 mmHg. Body temperature. Normal range, 97.7 to 99.4 degrees Fahrenheit, 36.5 to 37.5 degrees Celsius. It's important to remember that these ranges are general guidelines, and actual values can vary based on the baby's individual characteristics and health status. What are other signs of skin color? Normal skin color may vary based on a person's ethnicity and can range from pale to light, medium, or dark tones. During a physical examination, healthcare professionals may observe the skin color to detect any signs of abnormality, such as pallor. Pale skin may indicate anemia, poor circulation, or shock. Cyanosis, bluish skin suggestive of insufficient oxygenation of the blood. Jaundice, yellowing of the skin and eyes may be a sign of liver or gallbladder issues. Erythema, redness can indicate inflammation or increased blood flow to a specific area. What are the common emergency drugs? Emergency drugs are medications used in critical or life-threatening situations to stabilize patients and provide immediate treatment. The specific emergency drugs used may vary based on the healthcare facility, medical specialty, and local protocols. Here is a list of some common emergency drugs. Epinephrine, adrenaline used for severe allergic reactions, anaphylaxis, and cardiac arrest. Naloxone, used to reverse the effects of opioid overdose and respiratory depression. Atropine, used for symptomatic bradycardia, slow heart rate, and certain poisonings. Nitroglycerin, used for angina, chest pain, and acute heart failure. Aspirin, given during a suspected heart attack to reduce clot formation. Glucose, used to treat hypoglycemia, low blood sugar, in diabetic emergencies. Albuterol, used for acute bronchospasm in asthma or COPD exacerbations. Diphenhydramine, used for mild allergic reactions or anaphylaxis in conjunction with epinephrine. Diazepam, Valium used to control seizures and acute agitation. Lorazepam, Ativan used for seizures, anxiety, or acute agitation. Adenosine, used for supraventricular tachycardia, SVT, to restore normal heart rhythm. Dopamine, used for hypertension, low blood pressure, and shock. What are the proper hand washing techniques? Proper hand washing is one of the most effective ways to prevent the spread of infections. Here are the steps for the recommended hand washing technique. Wet your hands, turn on the tap and wet your hands thoroughly with clean, running water. Adjust the water temperature to a comfortable level. Apply soap, dispense an adequate amount of soap, liquid, bar, or foam onto your hands. Make sure to cover all surfaces. Rub palms together. Rub your palms together in a circular motion, creating a ladder. Ensure the soap covers the entire palm area. Interlace fingers, interlock your fingers, and rub them together, cleaning the spaces between them. Scrub back of hands, place one palm on the back of the other hand and interlace fingers. Rub your hands together, ensuring you clean the back of each hand. Clean the thumbs, using a rotational movement. Clean your thumbs by encircling them with the opposing hand. Clean fingertips. Rub the tips of your fingers on the opposite palm in a circular motion to clean the fingertips. Clean the nails. Clean under your nails by rubbing them against your palm. Rinse thoroughly. Hold your hands under clean, running water to rinse off all soap and lather. Dry your hands. Use a clean towel or air dryer to dry your hands thoroughly. Ensure they are completely dry to prevent the transfer of microorganisms. Turn off the tap. If possible, turn off the tap using a paper towel to avoid recontamination. Hand washing should typically take at least 20 seconds to ensure effective cleaning. If soap and water are unavailable, you can use an alcohol-based hand sanitizer with at least 60% alcohol content. What are the common sites of check a pulse? The common sites to check a pulse are: radial pulse, located on the wrist, on the thumb side. To check the radial pulse, place your index and middle fingers gently on the inner wrist, just below the base of the thumb. Carotid pulse, located in the neck, on either side of the trachea, windpipe. To check the carotid pulse, place your index and middle fingers on one side of the neck, slightly to the front of the sternocleidomastoid muscle. Brachial pulse, located in the inner aspect of the upper arm, between the biceps and triceps muscles. The brachial pulse is commonly used in infants and young children. Femoral pulse, located in the groin area, in the upper thigh. To check the femoral pulse, place your index and middle fingers just below the inguinal ligament, midway between the pubic bone and the anterior superior iliac spine. Popliteal pulse, located behind the knee. To check the popliteal pulse, bend the knee slightly and place your fingers in the crease behind the knee. Dorsalis pedis pulse, located on the top of the foot, between the first and second toe. To check the dorsalis pedis pulse, place your fingers on the foot's dorsal surface, just lateral to the extensor tendon of the big toe. Posterior tibial pulse, located on the inner ankle, behind the medial malleolus, ankle bone. To check the posterior tibial pulse, place your fingers just behind the medial malleolus. It is essential to use gentle pressure when checking a pulse to avoid obstructing blood flow. Count the number of beats felt in a 60-second interval, or for 30 seconds and multiply by 2, to determine the heart rate. Monitoring a person's pulse is essential for assessing heart rate and rhythm, and it provides crucial information about the individual's cardiovascular health. Name some antibiotics medicines and their use cases. Here are some common antibiotics and their use cases that you may encounter as a staff nurse. Amoxicillin. Use. Amoxicillin is a broad-spectrum penicillin-type antibiotic used to treat a variety of bacterial infections, including respiratory tract infections, ear infections, urinary tract infections, and skin infections. Ceftriaxone. Use. Ceftriaxone is a third-generation cephalosporin antibiotic used to treat severe bacterial infections, such as pneumonia, meningitis, and complicated urinary tract infections. Azithromycin. Use. Azithromycin is a macrolide antibiotic used to treat respiratory infections like pneumonia, bronchitis, and sinusitis, as well as certain skin infections. Metronidazole. Use. Metronidazole is an antibiotic with antiprotozoal properties, commonly used to treat bacterial infections in the gastrointestinal tract, as well as certain sexually transmitted infections. Doxycycline. Use. Doxycycline is a tetracycline antibiotic used to treat respiratory tract infections, skin infections, urinary tract infections, and certain sexually transmitted infections. Vancomycin. Use. Vancomycin is a glycopeptide antibiotic used to treat severe bacterial infections, including those caused by methicillin-resistant Staphylococcus aureus, MRSA, and Clostridioides difficile, C. difficile. Ciprofloxacin. Use. Ciprofloxacin is a fluoroquinolone antibiotic used to treat a variety of bacterial infections, including urinary tract infections, respiratory tract infections, and skin infections. Gentamicin. Use. Gentamicin is an aminoglycoside antibiotic used to treat severe bacterial infections, including certain bloodstream infections and serious respiratory tract infections. Can you explain site of injection? Site of injection. The site of injection refers to the location on the body where a medication or vaccine is administered through an injection. Common sites of injection include deltoid muscle, located in the upper arm. This site is often used for vaccinations, such as the flu shot. Ventrogluteal muscle, located on the side of the hip. This site is commonly used for intramuscular injections. Vastus lateralis muscle, located in the thigh. This site is frequently used for injections in infants and young children. Dorsogluteal muscle, located in the buttocks. This site is not recommended for injections due to the risk of damaging the sciatic nerve. What do you mean by COPD? COPD stands for chronic obstructive pulmonary disease. COPD is a progressive lung disease that causes chronic inflammation and obstruction of the airways, leading to difficulty in breathing. It includes conditions such as chronic bronchitis and emphysema. Patients with COPD often experience symptoms such as shortness of breath, persistent cough, wheezing, and excessive mucus production. COPD is commonly caused by smoking, exposure to air pollutants, and other environmental factors. What do you mean by NVD? NVD is an abbreviation for three common gastrointestinal symptoms: nausea, vomiting, and diarrhea. These symptoms can be caused by various factors, including viral or bacterial infections, food poisoning, medication side effects, motion sickness, or other medical conditions. Can you explain BLS? BLS stands for Basic Life Support. BLS is a set of emergency life-saving techniques and skills that are used to provide immediate care to individuals experiencing cardiac arrest, respiratory distress, or other life-threatening emergencies. BLS includes cardiopulmonary resuscitation, CPR, which involves chest compressions and rescue breaths to maintain blood flow and oxygenation to vital organs until advanced medical help arrives. BLS is typically the first level of medical intervention provided by healthcare professionals, including nurses, in emergency situations. Can you explain ALS with emergency drugs? In the context of emergency medicine, ALS stands for Advanced Life Support. ALS is a set of advanced medical interventions and techniques used to manage life-threatening medical emergencies, such as cardiac arrest, severe respiratory distress, and other critical conditions. While the specific drugs used in ALS may vary based on local protocols, guidelines, and the patient's condition, some common emergency drugs used in ALS include Epinephrine, adrenaline used to treat cardiac arrest, anaphylaxis, and severe bronchoconstriction. Amiodarone, used to treat life-threatening cardiac arrhythmias, especially during cardiac arrest. Atropine, used for symptomatic bradycardia, slow heart rate, and certain poisonings. Sodium bicarbonate, used for severe acidosis and certain toxic ingestions. Vasopressin, used as an alternative to epinephrine in cardiac arrest situations. Lidocaine, used to treat ventricular arrhythmias during cardiac arrest. Naloxone, used to reverse the effects of opioid overdose and respiratory depression. Magnesium sulfate, used to treat certain cardiac arrhythmias and eclampsia. Glucose, used to treat hypoglycemia, low blood sugar, in diabetic emergencies. What are some high-risk medicines? During a nursing interview, when discussing high-risk medicines, it is essential to focus on medications that have a higher likelihood of causing significant adverse effects or complications if not properly administered or monitored. Some examples of high-risk medicines include anticoagulants, medications like warfarin or heparin, used to prevent blood clots, can lead to serious bleeding if the dosage is incorrect or if there are interactions with other drugs. Insulin, used to manage diabetes, insulin requires precise dosing to avoid hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. Chemotherapy agents, drugs used in cancer treatment can have severe side effects and require careful administration to minimize toxicity. Opioids, strong pain medications like morphine or fentanyl can lead to respiratory depression and other adverse effects if not used cautiously. Sedatives and anesthetics, drugs used to induce sleep or provide anesthesia can cause respiratory depression or other complications if not administered and monitored properly. Potassium supplements or 4-potassium can be dangerous if given inappropriately, as it can lead to cardiac arrhythmias. Antibiotics, some antibiotics can cause severe allergic reactions or have toxic effects on certain organs if not used correctly. Antiarrhythmics, medications used to treat irregular heart rhythms can have significant side effects and interactions with other drugs. Tell me about NG tube feeding procedure. NG tube feeding, nasogastric tube feeding, is a method of providing nutrition and hydration to patients who are unable to consume food orally or have difficulty swallowing. The NG tube is a flexible tube inserted through the patient's nose and passed down the esophagus into the stomach. It allows the delivery of liquid nutrition directly into the stomach for absorption. Here is an overview of the NG tube feeding procedure. Can you explain 4 cannula? An 4 cannula, also known as an intravenous cannula or 4 catheter, is a medical device used to access a patient's veins for the purpose of delivering fluids, medications, or blood products directly into the bloodstream. It is a hollow, flexible tube that is inserted into a vein, allowing healthcare providers to administer treatments, hydrate the patient, or obtain blood samples for diagnostic testing. The process of inserting in 4 cannula is called venipuncture or 4 cannulation, and it involves the following steps. Preparations. The healthcare provider selects an appropriate vein and prepares the necessary equipment, including the 4 cannula, sterile dressing, and securing device. Cleaning the site. The selected area of the patient's skin is cleaned and disinfected to reduce the risk of infection. Insertion. The 4 cannula is gently and carefully inserted into the vein. The provider may use a tourniquet to make the vein more visible and easier to access. Securing the cannula. Once the cannula is in place, it is secured to the patient's skin with tape or a transparent dressing. Flushing the line. The provider flushes the 4 line with a small amount of saline solution to ensure that the cannula is patent and to prevent clot formation. 4 cannulas come in various sizes, with different gauge numbers indicating the diameter of the tube. The appropriate size and gauge of the 4 cannula depend on the patient's condition, the required infusion rate, and the type of treatment being administered. Explain the common side effects of antibiotics. Common side effects of antibiotics include gastrointestinal upset, nausea, vomiting, diarrhea, and abdominal pain are common side effects of many antibiotics. Allergic reactions. Some individuals may develop allergic reactions, ranging from mild rashes to severe anaphylaxis. Yeast infections. Antibiotics can disrupt the natural balance of bacteria in the body, leading to yeast infections, particularly in the mouth, thrush, or genital area. Photosensitivity. Certain antibiotics can make the skin more sensitive to sunlight, increasing the risk of sunburn. Diarrhea and Clostridioides difficile, C. difficile infection. Prolonged use of some antibiotics can lead to diarrhea and increase the risk of C. difficile infection. Dizziness or headache. Some antibiotics may cause dizziness or headaches in some individuals. Alter taste or smell. Some antibiotics can temporarily affect the sense of taste or smell. It is important to report any side effects to healthcare providers to determine if any adjustments in treatment are necessary. What is the primary medication used to provide relief during a major heart attack? The primary medication used to provide relief during a major heart attack is nitroglycerin. Nitroglycerin is a vasodilator that helps to widen the blood vessels, improve blood flow, and relieve chest pain, angina, associated with a heart attack. It is typically administered under the tongue, sublingually, or as a spray to quickly alleviate symptoms and improve the heart's blood supply. However, it is essential to seek immediate medical attention during a heart attack, and nitroglycerin should only be taken as prescribed or directed by a healthcare professional. Continuing on to the next video, we have part 2 of nursing interview questions and answers.